Pretoria has found that vaping has increased by 900% among high school pupils. The findings conducted over 6 years also found that this number is tenfold higher for the age groups of 16 to 35. We're now joined by Professor Richard van Smit, a pulmonologist at the University of Cape Town, and Sibongile Monareng, Director of Psychosocial Support at the Department of Basic Education. A big thank you to both our guests. Doc, let me perhaps start with you, or Prof, rather. Let's start with you, and you can tell us why young people are taking to vaping.
So yeah, thanks for having me on board. The data that you referred to was a pilot project that we did, and we're now doing a much bigger project across the country. And it is of major concern why young people are taking up vaping. I think there are two elements to it. One is the easy availability and the lack of messaging around the potential harm. So it's supposed to be safe, it's freely available, and all of that messaging, which is part of the reason why they're able to take it up. And the findings that you are referring to are the concerns amongst the adolescents, the high school learners who we interviewed around vaping as to why they continue to vape. What's vaping doing for them? And for many of those, it's coping with stress and anxiety as it's playing out in their lives. And so that really is the major concern, that vaping is being used as in a sense, a self-medication to deal with the pressures of being young.
I was very much interested in that point that young people make in this report, where they say they use vaping to deal with stress and anxiety. From what?
So we haven't specifically gone into the schools to ask them that question, the of what question. But I think if one just looks at the youth of today, we've had COVID, we've had the social isolation around COVID, we've had the pressures of South Africa, we have the pressures of finances, we have the pressure of unemployment potentially, we've got the pressures of global war. There are so many things that are going on around them that I think it's not inconceivable that just life in general is particularly stressful. Plus, you then have to negotiate being an adolescent and growing up in a very, very difficult space. Plus, you add the issue of school. So I think there's a multitude of potential reasons. We haven't delved down to say, is it your parents, is it your teachers, is it your exams, which is the most important part that's causing anxiety or stress. But clearly, these young people are under an enormous amount of pressure from multiple areas, I suspect.
Fair enough. Ms. Monareng, what is your understanding of the what? And does the what matter? Because sometimes when, I don't know about you, but some of us when we were growing up and you would mention that you've got anxiety or stress, it would be a thing of from what really? You're so young. You've got nothing to stress about. So does the what matter? And what is it that you are understanding as a department about what is stressing our children so much?
I want to agree with the professor that there's a multitude of factors that are causing our young people stress. And this is why, as the department, we do have the care and support programs, because we understand that learners are affected by what is happening in their homes, in the society in general. And we also know that there are so many pressures from social media as well as school. So our plan really is to focus on building learner resilience. Some of the studies that we are recently looking at are showing us that young people don't necessarily know exactly what to do when they are feeling stressed, when they're experiencing anxiety, or when they're experiencing depression. It's very easy to take for granted that information is available. So we are planning to go on a big mental health awareness drive. To not only give information but also to give our our young people skills or coping skills in terms of how to identify, for instance, when you have anxiety, irrespective of what is causing that anxiety. Like right now, we are approaching exams. We know for a fact that a lot of our young people are going to experience anxiety, and some might turn into alcohol or even vaping as a way of trying to deal with that anxiety. And unfortunately, those substances, they get what is the word, addicted to such substances. So our responsibility becomes providing information and also giving young people information about where to go when they feel they need professional help.
Prof, you're a pulmonologist and you deal with the respiratory system. Vaping is said to be much healthier than your mainstream or your conventional way of smoking, which is cigarettes. What have you found?
So I want to challenge you on that point, and the issue is that if you are an adult smoker, the data would suggest that vaping is a safer alternative. That has got absolutely nothing to do with a 15, 16-year-old growing up to say, ooh, it may be less dangerous than tobacco. Fresh air is what they should be breathing in. So I think that's the big challenge with the messaging here, is that all the social media, the advertising is saying safer than tobacco, which only applies to an adult who is smoking. It doesn't apply to a young person. And interestingly, even as a pulmonologist, I'm more concerned with the mental health impacts of nicotine contained in vaping, in terms of anxiety, depression, worsening at long-term mental illness, in addition to, yes, the damage to the little hairs in the lungs, the cilia, potentially developing emphysema later on. But those are down the track problems that we are trying to avoid. The acute issue is this high school learner who's using nicotine to cope, which is a very bad way of coping, because your brain then trains to, I'm anxious, here's some nicotine, neurological response, and every time you're in that space, you keep driving that pathway. And so where your brain should be learning and studying and gaining activities and insights, it's going round and round this stress, anxiety, nicotine, dopamine response pathway. So I think in terms of young people, the mental health elements are far more worrying. Yes, the long-term lung damage, the long-term heart damage is something we're worried about. Even the immune system, in terms of risks for infections like pneumonia or TB, are important. But I think at this stage, it's the mental health elements that are the most concerning. And said, coming from a pulmonologist who looks after people with lung disease, you need to understand that if I'm more worried about the brain, then it must be a serious issue.
I mean, Ms. Monareng, and that's just it, right? If we speak about the mental health issue, we are dealing with, in Gauteng at least, the increase or a rise. We're seeing a rise in the number of young people, students, high school learners who are taking their own lives. And perhaps the department is doing more investigations into what are some of the factors behind that. But what is the way forward, I guess? You spoke of some of the plans that you are going to be putting into place, but this is almost reaching crisis level.
It is, and we're also equally concerned. The department is trying to put as many resources as possible. Our life orientation curriculum is being updated. It includes information about substance use. It includes information about coping with stress, for instance. We are conducting webinars with teachers and school principals and school governing bodies. But another key factor in supporting learners is parents and the community themselves. Our sense is that as much as we're going to be providing resources in terms of additional non-professional staff to support teachers in schools, because we know we do not have enough mental health practitioners in the country. We also don't have enough social services professionals. We are utilizing non-professionals to work with the schools so that when teachers do identify, or even the learner support agents themselves identify that a learner is not doing well and is not coping well, they are able to quickly refer to either the Department of Health or Social Development. We do recognize that parents and the community are a critical pillar in assisting learners with support, because learners are in a school for a number of hours. However, the support has to continue when they get at home as well. So we are also intending to make sure that as we provide information to learners, we also provide information to parents about mental health, and we also making sure that we address the stigma of mental health. When you think about October, the theme for mental health commemoration this year is dealing with the stigma. So we're going to make sure that we're addressing stigma with our young people, but also we're putting effort in terms of communities and parents.
Unfortunately, that's all the time we can afford. Thank you very much to both our guests. Professor Richard van Zyl Smit, pulmonologist. Sibongile Monareng is the Director of Psychosocial Support at the Department of Basic Education. More news for you in a few moments.